Thanks for joining us for Diversity in Healthcare, a presentation that focuses on end-of-life care for Muslim patients. This video was made possible through the generous support of the Hospice and Palliative Nurses Foundation and the American Nurses Foundation. Throughout this presentation, we use cultural competency to indicate moving a step beyond cultural awareness and into action. Through this term, we invite viewers to go past simply having the knowledge to actually implementing it and accommodating religious needs. By no means does competence denote that one is an expert or that there's a one-size-fits-all solution for patients. But we hope that you join us in the spirit of understanding your patients in a way that ensures that they have the most inclusive care possible. Please note that this presentation does not constitute legal or medical advice. If you have questions or comments, please call our office at 833-224-7352, or you can email us at info@fl.care.com. We work within various systems of society, like the healthcare system, to educate on Muslim cultural competency. For this presentation, we'll be focusing on end-of-life care for Muslim patients. But before diving into end-of-life care, it would be helpful to discuss an overview of understanding and providing care for Muslim patients generally. Let's begin there. Why does it matter? Well, we believe in the power of communication, and we believe that having these conversations builds bridges based on mutual respect and understanding. There's a growing number of Muslims in the US, and more people means more presence in the world of healthcare. In fact, Pew Research projects that by the year 2050, there will be about 8 million Muslims in the United States. You'll probably see at some point of your healthcare career a Muslim patient. This could be someone at any stage of their life, from birth to end-of-life care. As healthcare professionals, it's critical to be sensitive to religious preferences while continuing to uphold the Hippocratic Oath. You have the unique responsibility of delivering medical care while also being sensitive to your patient's religious and cultural practices. Ultimately, better care starts with inclusive care. Being inclusive means viewing other backgrounds without judgment or prejudice, and going beyond that to embracing people's differences, and to the best of your ability as a healthcare worker, to including consideration of different cultural and religious preferences in your medical care. For so many people from various backgrounds, a medical crisis can be a spiritual awakening. It can certainly lead to a heightened commitment to prayer and religion, and the ability for a patient to comfortably lean on their spirituality is critical to their medical experience, and it's often an important part of their psychosocial betterment as well. Because of this and all these reasons, it's immensely valuable for healthcare professionals to study religious and cultural competency. The golden rule is show sensitivity for your patient's faith. When you, as a healthcare worker, take the time to let your patient know that you're giving them optimal medical attention while at the same time being sensitive to their faith considerations, that shows cultural competence. That shows empathy and emotional intelligence, and it shows that you care. At a basic level, this can be done by asking your patient, is there anything that I need to know about your faith related to your healthcare? It's important to draw your attention to the fact that Islam is a global religion, meaning there are Muslims in countries all over the world. A Muslim is someone who follows the religion of Islam. A common mispronunciation is to say Muslim with a Z instead of Muslim with an S, and a common misnomer is asking a Muslim, "Are you Islamic?" And Muslims have diverse cultural backgrounds. They're not a monolith. So you may find some variations in practices based on who's in front of you. Statistically, 60% of Muslims in America report having faced discrimination, and more than any other faith group that experiences religious discrimination, Muslims encounter this on an institutional level. In a 2020 poll on American Muslims, 25% of those who had faced discrimination indicated it was when they were receiving health care. Here are some questions we'd like to invite you to ask yourself and reflect on. First, do I feel differently when I hear a patient speak with an accent? Or, am I surprised when an ethnic-looking person speaks perfect English? Perhaps, do I make assumptions about a patient's education level based on how they're dressed? Or when I see female patients wearing hijab, the headscarf, or niqab, the face covering, do I sense a negative feeling? If so, why is that? It's okay to sit with these questions for a little bit. In fact, we recommend that you do, because a lot of times we're quick to answer these questions in a way that we know is better or more culturally sensitive. But we want to take a moment to remind you that having an implicit bias toward another group of people doesn't mean we're horrible people. In fact, it means we're normal people, affected by media, messaging, or maybe our own experiences or stories of others. But to improve, to be more inclusive and culturally sensitive, it does require reflection, education, and intention. And by that, we mean the intention to be better and to do better. When discussing diversity in healthcare with a focus on Muslim cultural competency, it's important to understand the basic foundations of Islamic beliefs, especially areas that may overlap with medical care. We'll address the 5 daily prayers, the Holy Scripture called the Quran and its significance in the life of a Muslim, particularly during hospitalization and critical care, views on illness and death, and family support. Let's start with prayer. And just like you'll find people of many faiths praying in a hospital, if you have a Muslim patient, you'll very likely come across moments where the patient or their family are praying. These 5 prayers a day are designated at specific times throughout the day. They're comprised of a series of movements from standing to bowing to prostrating, and each position is significant regarding your stance before God. Keep in mind that medical circumstances and procedures might prevent Muslims from praying in the traditional way, and as a result, you may find someone praying in a chair or in bed. Here are a few pointers on how to accommodate Muslim patients and prayer. Things you could provide include a prayer room or a worship area. Prayer rugs. This is great to have in common worship areas, but it would be so considerate to place a prayer rug in a patient room if you know that the patient is Muslim. And when Muslims pray, they turn to face the direction of Mecca. That direction is called the Qibla. So if possible, put something in rooms or in the chapel that shows the direction of Mecca. It's very simple to figure out. In fact, you can ask just about any Muslim staff member and they'll likely be able to help determine the direction of the Qibla. Now, in terms of considerations, here are a few things to keep in mind. If you can, allow for some privacy if you walk into a room where a patient is praying. Don't walk in front of a person who's praying, rather try to walk around them if possible. And when a Muslim is in a state of formal prayer, then typically they won't respond to a question or conversation until they've completed their prayer. That could take a couple of minutes or longer, but an average prayer takes about 5 minutes. If you're in need of prayer rugs, try reaching out to your local mosque, Muslim organizations like CAIR Florida, or implement creative alternative solutions like providing a large, clean towel for use. The Holy Book of Islam is called the Quran. Keep in mind that religious scripture is highly respected. It cannot be placed on the floor or in the bathroom, and it should always be in a clean place. In Islam, it's considered a religious duty to visit and care for those who are sick, whether it's family, neighbors, or community members. Often this means that both religious and family insight are considered in medical care. As a healthcare provider, feel free to clarify with your patient whether they want family intervention as part of their medical discussion and plan. From prayer, we'll move on to discuss Ramadan, the Muslim month of fasting. During this month, Muslims don't eat or drink anything from dawn until sunset. The last point on fasting is that it's a mandatory act of worship, but there are exceptions for those who have a valid excuse not to fast. For example, people who are ill or the elderly, women who are pregnant or nursing, they have the option not to fast given certain conditions. Here are a few considerations on how to accommodate Muslim patients and fasting. First, when preparing for the fast, encourage pre-dawn meals that include carbohydrates that release energy slowly. Second, remember that fasting restrictions aren't just things we eat or drink. Anything that enters the GI tract or offers nutritional value is not permissible while fasting. This includes inhalers, nebulizers, suppositories, oral medications, and dental care. When prescribing or administering medication, if possible, adjust the time that the patient has to take the medication. If a patient develops hypoglycemia, they should be provided supplements. And finally, patients should not fast if blood glucose levels fall to dangerous levels. Moving along, we'll talk briefly about a Muslim's diet in the context of what's generally allowed to eat or drink and what's not. In terms of what's allowed, religiously, all food products are permitted except if otherwise indicated. Keep in mind, though, that in times of necessity or preservation of life, even what's considered prohibited may be allowed. There are, however, specific things that are not allowed for a Muslim to eat or drink. They're religiously prohibited, and consuming them is considered a sin. So it's important to give attention to these things. The common areas are pork and all the ways that it's presented. For example, lard or gelatin in food or desserts, or porcine in medicine. Alcohol, which can be found in common medicines, often linked with the word elixir name. It's often found in mouthwash or just the drink in general. Any alcoholic beverage is religiously not permissible to drink. Regarding meat in general, many Muslims only eat meat that's prepared in accordance with religious guidelines. So, chicken or beef, for example, would have a halal label, halal meaning permissible, and that meat is often also known as zabiha, which is a word that's closely equivalent to the Jewish kosher. Some Muslims won't eat non-zabiha meat or meat they consider not halal, and that's particularly important for food services to be aware of so that proper alternatives can be offered. Medicines that contain non-halal ingredients, one of the more common hypothyroid medicines, Armour thyroid, is derived from porcine thyroid glands. Many people don't know this, and it would be appropriate to offer a non-porcine alternative that treats the same condition. Some other common restrictions found in medicines include gel capsules. They're so common, yes, but they also very often contain gelatin. Doctors have recommended looking for non-pork, vegetarian, or vegan alternatives. Finally, there are some medicines that are porcine-based that might be injected, not ingested. An example of that would be a heparin shot. Patients should be informed if the medicine being prescribed contains restricted ingredients, and they should be given the option to choose an alternative medication where possible. Even in the example of heparin, which is injected and not administered orally, some patients may prefer a low molecular weight heparin, which is not porcine-based, if appropriate. Patients can be asked about their use of alternative medicines to identify possible contraindications, drug interactions, or side effects. From here, we move on to the topic of patient etiquette. We'll start with appearance. The first point of interaction between healthcare workers and the patient is often visual, and it's common for Muslim female patients to wear a hijab, the same way it's common for Muslim males to have a beard. The truth is, many people pass judgment based on physical attributes, like the beard and the hijab, and sometimes it's subconscious. Hijab generally refers to the head covering that Muslim women wear. Hijab also includes covering the body. But for many Muslim women, hijab is incredibly liberating and represents all sorts of personal and social freedoms. When a Muslim woman starts wearing hijab, she'll cover in front of males who aren't related to her. So she won't have to cover in front of her husband, her father, brothers, or sons. But outside of her nuclear family, she'll cover her hair and body. And that includes, of course, in front of men in the healthcare world. Women don't have to cover in front of other women, so the situation is different for female doctors, nurses, chaplains, techs, food service workers, etc. So if you know that a female patient is Muslim, the best thing to do is ask her about any preferences she may have. You might notice that some of your Muslim male patients have a beard. It could be a short beard or a very long beard. For Muslim men, keeping a beard is a religious recommendation that a lot of men uphold. Healthcare workers should always prioritize a Muslim patient's request to wear hijab while receiving medical care, unless a medical emergency necessitates otherwise. Do not remove a lady's hijab unless it's medically necessary. And if you need to completely expose a patient, male or female, only expose what's needed of the body, preferably in sections, and only expose the body for as long as is needed, and then cover the patient up as soon as that need has passed. Additionally, Don't shave a Muslim man's beard unless it's medically necessary, and if possible, make sure you discuss that with the patient beforehand. Medical necessity overrides religious rules, but when there isn't a medical emergency, then a patient's religious preference should be considered and respected. From an Orthodox Muslim perspective, physical interaction is not permitted between members of the opposite gender. One thing we suggest that might help avoid an awkward moment is to consider allowing the patient or the patient's family to extend their hand out first. Religiously, lowering one's gaze when speaking to someone of the opposite sex is an expression of modesty. If possible, try to provide a same-sex healthcare worker to care for the patient. And where possible, demonstrate these points of cultural competency when you're interacting with patients. Let's discuss issues related to hygiene. Religiously, cleanliness is heavily emphasized with teachings like cleanliness is a part of your faith. Now, side note, what you'll encounter in terms of cleanliness definitely will be influenced by certain factors like socioeconomic status and even individual culture. But regardless of who's in front of you and what their personal hygiene looks like, there are a few important points that Muslims likely share. We'll start by explaining the difference between something being dirty and something that's considered impure, which has a religious connotation. Dirty can refer to spilled food, dust, dirt, basically things that aren't pleasant but aren't intrinsically impure. Impurities refer to things like urine, fecal matter, semen, or blood. The reason this distinction is critical is because regarding impurities, not only are they dirty, but religiously they also invalidate your prayer and your state of cleanliness. So on this point of hygiene, the emphasis is that if a patient has any of these impurities on them, like on their clothes, their bed sheets, it's not sufficient, for example, to wipe them down. To properly clean these items, remove the physical impurity from the patient's body or clothing altogether, replace the items that contain the impurities, and possibly offer the patient a chance to shower or wash up. And on that note, you might also notice that some Muslim patients wash their bottom with water after using the bathroom, and it's for the same reasons of removing or washing away impurities. Again, this is important for various reasons, including that impurities need to be removed in order for a person to be in a suitable state for prayer.
We're now going to focus on end-of-life care, a vital time in any patient's care journey.
Here we'll talk about some things you may notice from your patients regarding end-of-life feelings, emotions, and beliefs. Regarding religious context, a key Islamic principle of belief is the notion that God created us, that we belong to Him, that this is a transient life and that it is a test, and that we should all be working to gain God's favor because ultimately we will all return to Him. This concept is summarized in a verse from the Quran that reads, "To God we belong and to Him we return." You'll probably hear people say this to family members of a person who passes. It's meant to encourage patience and submission to God's will. And it also reminds people that life is transient and that we should live in preparation for an eternal afterlife. On the topic of acceptance, you'll find that often patients mentally and emotionally prepare for death. As we mentioned, there's the religious principle that we belong to God and we return to Him. So begins the full resignation to God's will. And on the topic of suffering, pain and misery are not punishments for one's sins. Rather, as we mentioned earlier, they can be an expiation or forgiveness of sin and a way to gain closeness to God. Also with suffering, there's the promise of great reward for those who exhibit patience in the face of affliction. Now, regarding fear of death, in Islam, there is strong emphasis on personal accountability, and the concept of salvation doesn't exist. Muslims believe that all of our actions in this life will be judged by God and that we'll be rewarded or punished accordingly. And on this point of fear of punishment, Muslims believe that if someone sincerely repents, personal mistakes can be forgiven by God's mercy. But the concept of justice is heavily and consistently emphasized in Islam, and injustices against others require that the person who was mistreated forgive the one who committed the injustice. And so you'll find that people in this stage of life may seek forgiveness and redemption with others. Common things you might notice during end of life care include having an influx of visitors, an increased recitation or playing the Quran, increased prayer and supplication, seeking forgiveness from others whom one may have wronged, and paying off debts. During these critical times, remember that cultural and religious competence is critical to provide effective comfort. Try to balance visitors with the patient's need for space, especially if the patient communicates that's what they want, a break from visitors. Provide a Quran and accommodate a space to pray, a prayer rug, and Qibla information, which again, Qibla is the direction for prayer. And finally, allow imams to provide support to Muslim patients and recruit Muslim imams if possible. When it comes to ending life support, this is, of course, an incredibly difficult issue to navigate for all those involved. From an Islamic perspective, there are some key considerations regarding intervention. People of faith are generally taught to be hopeful and to have faith in God's ability to do all things and change all circumstances. And sometimes that hope, that praying for a miracle, that trust in God doesn't align with the objectivity of science. Similarly, we've spoken to family members of Muslim patients who expressed a lot of frustration around what they perceive to be callousness or insensitivity to their wishes to hold on to their loved one and wait for a positive turn or wait for a miracle. We'll wrap up with a discussion of how Muslims view death and common protocol after a person passes. At the moment of death, Muslims believe that the soul leaves the body and is in a transitional state until Judgment Day. Before a person passes away, you'll find many Muslims playing or reciting Quran next to the person who's transitioning out of this world. And in the final moments in particular, the dying person will be encouraged to repeat what's known as the Shahada, which is the testimony of faith in Islam. It literally reads, I bear witness that there is no God but one God, and that Muhammad is the messenger of God. Muslims try to have these words be their final words in this life. Also, a patient's suffering should be relieved to the maximum extent possible. After death, the eyes of the deceased should be closed, the body should be covered, though viewing is permissible. The body should be wiped down, but left intact to the extent possible. Lacerations should be sutured, and wounds should be closed to avoid fluids from leaving the body. Loud lamentation like crying, screaming, or being physical, all of that is prohibited in Islam, though culturally and even from a simply humanistic perspective, you may find some people doing that. It's important to note that cremation is not allowed in Islam. So if you have a patient who is Muslim, unless that was their personal request, then all measures should be taken to avoid cremation. Also, autopsies are not acceptable unless necessary. The Islamic tradition is to bury the deceased as quickly as possible. Most people will try to complete the burial on the same day, but if that's not feasible, then they'll aim to do so within a couple of days. The body should be sent to a funeral home for the required ritual washing before burial, and this washing is typically completed by the imam or members of the local Muslim community. So in summary, remember that when you're facing a situation that you're not certain how to navigate, refer to a Muslim chaplain or a local religious leader. Check resources from verified religious and professional websites. Remember that Muslims are not a monolith. They may have many different cultural influences and religious beliefs, and sometimes it's best to ask them about their personal preferences. Inform your patients about issues that you know contradict their religious practices and offer alternatives if available. And once again, know that you are not expected to be an expert in these religious matters. Having a general understanding, an open mind, an open heart, and clear communication are key. There are two main resources we want to leave you with. One is a summary one-pager on caring for Muslim patients, and the other is a resource guide with links to articles and studies that were referenced throughout the presentation. If you're interested in further reading about these topics, please take a look at these additional resources. Take a moment to visit our website and learn more about what we do. Our contact information is on the screen. Please reach out to us if we can be of any assistance to answer questions, offer clarification, plug you into community resources, or to plan an in-house training for your clinic or hospital staff if you're in Florida. We certainly look forward to connecting with you. And with that, on behalf of CAIR Florida and the Hospice and Palliative Nurses Foundation, thank you very much for joining us.